Hello, hi, good morning. My name is Angelito. I'm one of the nurse practitioner or student nurse practitioner for the Global. So I'm here to perform the head-to-toe assessment on you. Okay? All right. So first of all, can you tell me your name, please, and tell me your date of birth? Okay. And then tell me where you're at right now. All right, great. And then tell me who's the president of the United States. Okay, great, perfect. So my patient uh, is well appearing. As you can see, she's alert oriented time is 4 and she's conversant. And I don't see any sign of obvious distress on her. And looks like I'm going to go ahead and proceed to my head to toe assessment today. Okay, so first of all, I'm going to go ahead and examine your head. Okay, so I'm going to go ahead and inspect for any sign of deformities, any sign of depression. I'm going to feel the sign of any depression. Okay, I'm going to take a look now. Okay, I'm going to look for any sign of bumps. And you looks like you have a good equal hair distribution, ma'am. Okay, and also I'm going to check for the symmetry and the contour of your head. So it looks like it's fine to me. Okay, and then I'm going to go ahead and feel your forehead and tell me what hurts. Do you have any pain somewhere else? Okay, about here? No. Okay. All right. Okay. Now I'm gonna go ahead and feel and palpate her occipital area for any sign of bumps or masses or any sign of lumps on the surroundings of her head. It looks great to me though. Okay. And the next, I'm gonna go ahead and uh, examine your eye. Okay, we'll go ahead and proceed to your eye. So I'm gonna inspect for the symmetry of your eye. Looks like it's okay to me, and I'm gonna go ahead and start examining your eye by using my ophthalmoscope. Okay, all right. Okay, all right. You will see a bright eye. Okay, so just look on the left ear. Okay, good. Look straight for me, please. Okay, while I'm looking on your pupil. All right, and then look on my right ear. All right. Looks like I don't see any sign of hemorrhage or any sign of injury to your eye. So then I'm gonna go ahead and check for your visual acuity, ma'am. Okay. Do you wear any glasses, ma'am? All right. So with this nouns chart, just hold it for me at least like this far, and then tell me which one you can see, the smallest letter you can see. Perfect. And then cover your right eye for me. Tell me what is this? Okay, perfect. And then cover your other eye. Looks like she's 2020 for me, and I don't see any sign of problems on the visual acuity. And then next thing I'm gonna do is I'm gonna go ahead and check for your visual fields. Okay, all right. So tell me if you can see. I'm gonna move my fingers towards the front and just look straight. Okay. Tell me if you can see now. Okay. All right, perfect. And I want you to follow this finger with your eye. Don't move your head. Okay. All right. Good. And then follow this your eye here. How about here? Good. And how about this one? And this one. All right. Looks like he has a good extraocular movement. I don't see any abnormalities on his eye muscles. Okay. And then also, uh, I'm gonna go ahead and ask you to follow this pen for me. Okay. All right. All right. So looks like normal to me again. And then next thing I'm gonna do, I'm gonna go ahead and examine your ear. Okay. So do you have any pain or tenderness on your ear? No. Okay. I'm gonna go ahead and try to feel your outer ear here. Do you have any pain here? No. No. How about here? No. Okay. All right. And then I'm gonna go ahead and use my otoscope, okay, to examine your ear, okay? All right. All right. You're gonna feel the pressure in your right ear for me, okay? Perfect. And then your other ear. Okay. I don't see any kind of um, bulging membrane on your ear. I don't see any sign of erythema. Okay, so it looks like there's no any also sign of impacted cerumen. It looks clean to me. Okay, now I'm gonna try to see if I can you can hear this. I'm gonna try just whisper on your left ear first, okay? And say again what I say, okay? One, two, three. 1, 2, 3. Perfect. And how about this one? A, B, C. A, B, C. Okay, perfect. Looks like I don't see any kind of hearing problems, and but this time also, while we're in the ear, we're gonna move on using my tuning fork. Okay, I just wanna do some kind of Karina's test and Weber's test. Okay, so tell me if you feel this vibration if I put it on the top of your head. Okay, can you feel in your both ears? Okay, how about this one? Yes. Okay, and this one. Yes. Okay, looks like you had a good conduction in your both ears. Okay, and then we're moving along to your nose. Okay, so I'm gonna go ahead and examine for any sign of abnormalities, deformities on your nasal bridge, and I'm gonna go ahead and check also for any sign of um, abnormalities on your both nostrils. Okay, so by doing it, so first thing I'm gonna ask you to if you could blow to your right nose. Do this one like this. Okay, blow to your nose. Okay, another one. Well, it looks like it's equal and there's no any problem with your both nose. Okay, so and then I'm gonna ask you to close your eyes. Okay, and tell me we can smell this. Yes. What is this? Uh, Scented candle. Oh, great, great. You got it. All right. And then I'm gonna go ahead and check your inner nostrils. Okay. Do you have any nasal polyps or any runny nose or you have any nasal congestion at this point? Okay. And then moving on to the next one. All right. I don't see any sign of redness. Uh, you have a good nasal turbinates. Okay. I don't see any sign of nasal polyps on you. Okay. And it looks like it's slightly pink on your nasal mucosa. Okay. All right. So moving along after this nose nasal examination, since that I'm in your nose, I'm gonna try to check for your sinus. Okay, so I'm gonna try to feel and palpate on your maxillary area. Tell me if it hurts. No. How about here? Does it no. Hurts? No. Okay. All right. And then I'm gonna go ahead and check for your temporomandibular joint. Okay, I'm gonna try to see if you have any tenderness on your TMJ. Try to open your mouth for me, ma'am. Open it, ma'am. Okay, did you feel any clicking sounds? Any tenderness? No? Okay, can you move your jaw from side to side? All right, perfect. Looks like I don't see any abnormalities on your jaw, okay? And then moving along, I'm gonna go ahead to examine your neck. I'm gonna go ahead and examine for your for any sign of enlarged lymph nodes throughout the surroundings on your neck. Okay. Okay. And then I'm gonna go ahead and examine for your thyroid. If you see any sign of enlarged thyroid. Okay. I'm sorry if I tickle you. Okay. I want you to swallow for me. I'm gonna move you here. Okay. I'm gonna ask you to swallow. Okay. Good. Perfect. I don't see any sign of enlarged thyroid at this point, and looks like your neck is symmetrical and in no any sign of deviation in your trachea. Okay. And then I don't see any sign of any mass or enlarged lymph nodes. So looks like you're good to be done. And then you could try to open your mouth for me, ma'am. Okay. Open your mouth wide. Okay, I'm trying to examine your uvula, your soft palate, your tongue. Your teeth is unremarkable. Your uvula is a midline. Your tongue is intact and normal to me. And if you could move your tongue from side to side. Okay, perfect. Up. Okay, good. So looks like you don't have any trouble with your tongue. Okay, and then can I take a look on your buccal cavity area? Pick up your tongue up. Okay. I don't see any sign of lesion. Okay. And I don't see any sign of rashes and anything like abnormalities to your mouth. Okay. So your mouth is moist and pink in color. Okay. All right. Moving along, while I'm on your face, I'm going to try to check for the sensation. Okay. And tell me if you feel this. Okay. Can you feel it?
Yes.
How about this?
Yes.
Okay. Then now you're gonna tell me if it's sharp or dull, okay?
Okay.
Is it sharp or dull?
Dull.
How about this one?
Oh, sharp.
All right, sorry. Okay, you got it. Thank you. Okay, so then we're gonna go ahead and start examining your respiratory exam, okay?
Okay.
By doing some, let me try to see if I can start on your back, okay? So I'm gonna try to observe the contour and the size of your thorax area, your posterior back, okay? And I'm gonna try to feel for any sign of tenderness. Tell me if it hurts here. Does it hurt?
No.
Okay. All right. Okay. And then next thing, I'm gonna go ahead and try to follow what I say. Okay. I'm gonna ask you to follow what I say. Say 99 if you feel my hand touching your back. Okay.
Okay. 99, 99, 99, 99, 99.
Perfect. And then I'm gonna try to see I can do some kind of like a percussion on your posterior back area, okay? So you're gonna feel some kind of like discomfort here, okay? Okay. All right. Perfect. And then moving along, I'm gonna go ahead and ask you to take a deep breath by use by because I'm gonna perform this doing your diaphragmatic excursion, okay?
Okay.
All right. So by doing it, so see, I have a ruler here. Okay, so I'm gonna percuss again your diaphragmatic area, okay? Take a deep breath for me. Exhale. Okay. How about this one? Exhale. Okay. Okay. It's like here. Perfect. Just measure here. All right, perfect. All right. Next along, we're gonna try to see if I can listen to your breath sounds, okay? So what I want you to do is just take a breathe in and breathe out for me when you feel my stethoscope touching your back, okay?
Okay.
Breathe in, out. Perfect. Great. Perfect. Okay, looks like you have a good equal breath sounds to me. And then I'm gonna go ahead and uh, say 99, say E when you feel my stethoscope touching your back, okay?
E,
Okay.
E, 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 E.
And then next thing I'm gonna ask you to do is whisper 1, 2, 3 when you feel this on your back, okay?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, perfect. All right. And then the next thing I'm gonna do is I'm gonna examine your thorax, anterior thorax, okay? I'm gonna examine your chest for any sign of symmetry and deformities on your chest. And also I'm gonna try to see for any sign of discoloration too as well, okay? And then tell me if it hurts when I feel your chest, okay? I'm gonna put my hands on your chest. Does it hurt?
No.
Okay. Okay. Then next along, I'm gonna go ahead and do a percussion to your thorax area, okay? Okay. And then I'm gonna ask you to say 99 again, okay?
99, 99, 99, 99.
Okay, perfect. All right. Then I'm done with your chest, okay? So let me listen to your breath sounds again on your anterior chest, okay? Take a deep breath in and out. Okay. Perfect. 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 All right. Looks like you have a good equal breath sounds, ma'am. Okay. Uh, Next thing, I'm gonna go ahead and examine your cardiovascular exam. Okay. I'm gonna do some cardiovascular examining you. Okay. By doing it so I'm gonna ask you to lay back on that bed for me. Okay. So we're gonna do some kind of like a little bit of elevation here so that I can examine your JVD as well. Okay. All right. Okay. So do you have any neck pain, any neck tenderness?
No.
Okay.
None.
All right. Um, then I'm gonna go ahead and measure your JVD. Okay. Can you do me a favor? I'm gonna ask you to look on your left. Okay. So I'm gonna try to see if I can visualize your jugular vein distension here. If any sign of GAVD here. Okay. All right. Do you have any pain in your belly?
No.
Okay. I'm gonna try to press your belly so that I can visualize more your GAVD. Okay. All right. See it from here. I'm gonna measure through angle of Louis. All right. Looks like we got it done. So I'm gonna go ahead and check for your carotid pulses, okay? All right. Gonna feel your pulse here. Right, it looks like you have a good carotid pulse here. And let me go ahead and listen to carotid pulses too, okay? All right. And then I'm gonna go ahead and listen to your aortic valve. Your pulmonic. I'm gonna listen to your pulmonic valve, okay? And your herbs, gusfit, and the mitral valve. Okay? Mind if you could turn in your left for me? I don't hear any kind of regurgitation in your mitral valve, okay? That looks good to me. And I'm gonna try to see to feel your point of maximum impulse, which is actually located in the fourth or fifth intercostal space. All right, okay. All right. Then next thing we're gonna do is gonna examine your belly while you're laying down, okay? So to visualize your abdomen, I'm gonna ask you to pull up your shirts for me, ma'am, okay? All right. So while I'm doing this, I'm trying to observe and inspect her abdomen for any sign of discoloration, any sign of bulging, or any sign of jaundice, discoloration to her skin, or ecchymosis. Right. Also, I'm trying to check for the pulsation in bruit. Okay. All right. Looks like I don't see any sign of pulsation. Looks good to me. Okay. And then I'm gonna go ahead and listen to your belly. Okay. I'm gonna listen to your bowel sounds. Okay. So this is gonna be cold, ma'am. Okay. Looks like you have a good bowel sounds, and I don't see any sign of abnormalities to your bowel sounds. Okay. So next, I'm gonna go ahead and do some kind of percussion to your abdomen. Okay. And then I'm gonna percuss your abdomen. Okay. Okay. All right. All right. And then also, I'm gonna go ahead and peel and palpate for your liver here, okay? So you're gonna feel a little bit tenderness, okay? I'm gonna do some kind of like light palpation first, okay? Tell me if it hurts. Does it hurt?
No.
And then I'm gonna do some kind of like a gentle pressure to your belly, okay? Does it hurt? Okay. Now this time I'm gonna go ahead and do some kind of like a rebound tenderness, okay? Tell me if it hurts. Does it hurt?
No.
How about here? No?
No.
How about here?
No. No.
Okay. Let me try to feel your liver here, okay? Sorry if I tickle you, okay? All right. Feel your liver down here, okay? While I'm here, I'm going to try to palpate your kidney on the right flank area. Does it hurt when I do this?
No.
Okay, perfect. Okay. So, do you have any belly surgery before?
None.
Okay, so your appendix still there, your gallbladder still there, right?
Yes.
Okay, I'm going to try to see if I can palpate your gallbladder here. All right. Do you have any pain?
Nothing.
You have no pain at all. So it looks like I don't see any gallbladder tenderness at this point. Okay. Uh, Next along, I'm gonna go ahead and check for your spleen. I'm gonna do some percussion in your spleen here. Okay. I'm gonna palpate for your spleen. Okay. Do you have any pain when I do this?
No.
Okay. Now I'm gonna try to see if I can feel your left kidney. Okay. All right. Thank you. Let me go ahead and listen to your aorta. Okay. And go ahead, renal artery. Then iliac. And I'm gonna check for your femoral artery. Okay. All right. Thank you. Let me see if I could do some kind of like prick your skin here. Do you feel any pain?
No.
No? Okay. All right. So next thing I'm gonna check if you have any kind of inflammation in your appendix. Okay. So I'm gonna ask you to elevate your leg. Okay. Pick, pick up your leg from me. Bend your knees. Okay. Tell me if it hurts.
No.
Okay. All right. Perfect. All right. And then this one, I'm gonna go and pick up your left leg. Okay. We're gonna move it a little bit inward. Okay, tell me if there's any pain on your belly.
No.
No? Okay, perfect. All right. Let me see if I can feel your aorta here. Okay. All right. All right. Thank you. And then looks like we're almost done with your abdomen. When was your last menstrual period, ma'am?
A year ago.
Okay. Do you have any pain when you urinate? Do you have any urine discoloration?
None.
Okay. I'm gonna ask you to sit right here for me to check your CVA tenderness. Okay. Okay. I'm gonna thump your back, okay?
Okay.
Tell me if it hurts. Does it have pain here when I do this?
No.
How about here?
None.
Okay, perfect. All right, thank you. I think we're done with your abdomen. So we're gonna defer your GU exam at this point, okay? So we're not gonna do any rectal or groin exam at this point, okay? So we're gonna move along, and then we're gonna try to examine your musculoskeletal, okay? So on your musculoskeletal, we're gonna try to check for your muscle tone, muscle strength, okay? And then this time, I'm gonna ask you to move your neck from side to side, okay? Move up and down, okay? All right. We'll like try to see if you can move against my hand. Perfect. Do you have any pain when you move your neck?
None.
So it looks like you have a good neck range of movement, okay? And then, do you have any pain on the shoulder joint when I do this?
None.
Okay, all right. Can you try to see if I can shrug your shoulder for me? Okay, good, good, perfect. And then I'm gonna try to examine your bulk of your muscles. Good. I don't see any sign of atrophy on your muscles. Okay. And then moving along, I'm gonna try to move your arm here. Okay. Okay. You have any pain when I do this?
None.
Okay. How about this one? No? Okay. And this? Can you try to move your arm? Do you have any pain?
None.
Okay, how about this? No?
Nothing.
Okay. How about when I move your wrist joint? No? And your elbow? No? Okay, good. And then we're gonna check your muscle strength, ma'am. Okay, do this way for me then. Okay? Pull against my arm. Good. And push. Okay, good. And do this. Okay? Okay, don't let it drop, okay? Perfect. All right, good strength. You're strong, man. You're strong. Okay, and then this time we're gonna go ahead and check for your strength on your lower extremities. Okay, I'm gonna ask you to push it against my hand. Good. How about this one? Perfect. And this one, push against my hand. Okay, this one. Can you wiggle your toes? Okay, I'm gonna move your knee joint. Okay. You have any pain when I do this?
None.
How about here?
No pain.
No pain? Okay. All right. So then what I'm gonna do, I'm gonna try to check for your ankle joint. Okay. All right. So I'm gonna try to do some manipulation here. See if we can move. Do you have any pain when I do this?
None.
Okay. I'm gonna try to check on your toes. Okay. Sorry. Okay. I'm gonna feel your pedal pulses here. Okay. Check a good pulse here. I don't see any sign. Do you have any swelling in your leg? No? Okay. Okay. All right. And then what I'm gonna ask you to do, can you lay down a little bit for me now? I'm gonna move this one. Okay. Okay. If you could do me a favor, I'm gonna ask you to touch your heel and slide on your left hip. Okay. Slide downward then. Okay. Good. How about this one? Good. Okay. I want you to pick up your left leg for me. Other one. Okay. How about this one? Pick it up.
My hand.
Yeah. Left
Yeah.
arm. Okay. And your right arm. Okay. Perfect. I want you to squeeze my hand. Squeeze as much as you can. All right. Good. Looks like you have a good equal hand grip for me. Okay. And then I'm gonna try to see if I can check your. Okay, good, good, good. All right, thank you. All right, and then go ahead and if you could have a seat for me again. So we're gonna do some kind of like I'm gonna check your coordination here, okay? So I'm gonna ask you to do some kind of like a rapid alternating move, okay? Okay, perfect. And then do this. Perfect. Okay, and then touch your nose and touch my finger, okay? Okay. All right, how about this one? Okay, good. All right, perfect. All right, then I'm gonna go ahead and check for your reflexes, okay?
Okay.
So I'm gonna check your brachial reflex here. Okay, perfect. This one. Okay, perfect. Then radial. Okay, and this one. Okay, perfect. And then we're gonna check your deep patellar reflex, okay? I'm gonna ask you to sit on the pillow. Okay, all right, perfect. And then let me go ahead and do your elbow. Okay, and this one. Okay, good, good, good. All right, great. So next one, I'm gonna check your Romberg's test. Okay, I'm gonna ask you to stand up for me. All right. I want you to walk straight towards me. Okay, perfect. And go walk with your both heels again. Looks like you have a good gait. Steady gait for me. Okay, you're ambulating. Okay. All right. Come over here, man. All right. Stay where you are now. Okay, I want you to close your eyes. Okay. Pick your arm out. I'm gonna check for Romberg's test. See. Are you feeling dizzy, ma'am?
No.
Okay. You okay?
Yes.
All right. Okay. I'm gonna push it. All right. All right. We're good, ma'am. Thank you. And then go ahead, have a seat right here for me. So we're almost done. Sorry. All right. So we're gonna check for the sensation in your arm. Tell me if it's sharp or dull. Okay.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay. Perfect. Then tell me if it's hot or cold. Okay. Close your eyes.
Cold. Hot. Cold. Hot. Cold. Hot. Cold. Hot.
All right. Perfect. Okay. Let me see your hand. So I'm gonna check for any sign of discoloration. So it looks like you have good circulation here. Okay. I'm gonna try to use my tuning fork again, okay, and put it in your finger. Can you feel it?
Yes. Yes.
Okay. And then I'm gonna go ahead and close your eyes for me and tell me one and 2, okay?
1, 2. 1, 2.
Okay.
1, 2. 1, 2. 1, 2.
All right. All right. Looks like we covered everything, ma'am. Your head to toe exam. And I don't see any sign of abnormalities on all throughout the exam. And I really appreciate on your participation, okay?
Okay.
And I'm looking forward to see you next year again for your annual exam, okay? And
Thank
thank
you.
you very much.
Yes. Thank you,
Okay,
sir.
bye.